We envisioned this platform about a year ago for our breast cancer patients where we thought it would be useful for them to be able to connect when they're not here. The cancer obviously doesn't stop because it's after hours or the weekends. And we saw that there was a gap and a need for us to create some way for the patients to get answers to their questions and also connect to other folks that may be going or have gone through similar experiences.
We certainly want to be able to answer as many questions as possible, even preemptively. The thing I want patients to know from the beginning is that they don't have to know everything about breast cancer from the beginning, and that the things that we talk with them about early on, we'll continue to talk to them and answer questions, and that there will be, as there are questions that come up, we will try to address them, and we are available either for in-person visits or in other ways. Outside of that, I think using resources like this Breast Connect website and other reputed resources is great.
Us as providers, we're always looking for what other support resources can help patients through what is a clearly challenging time on all fronts. And so, resources, whether they be support groups or online forums or websites or information that we can provide or referrals to other providers is a huge, huge help to our patients in terms of helping them find the resources they need, find the information they need, and get through this difficult time.
There's resources available for patients, but they often don't know. And it's sometimes in those conversations where we're just trying to really make sure you know how to manage your skincare as you're going through treatment, that other things come up and we can put them in connection with other resources and people. And oftentimes we have patients who mention over and over again that they want to be contacted if there's a patient who wants to kind of talk to someone who's been through it. And
with COVID, I think everybody's been in a little bit of a, challenging spot figuring out what is the best way to offer support, and the online resources have been probably the most impactful thing for patients. So that could be anything from online support groups to connecting with some of the cancer support centers that offer things like yoga, tai chi, meditation groups. There's just such a wide variety of support that's available online that it can really fit any need that does come up for a patient.
We envision this platform to be the place where they could get answers from both the experts, like the physicians and nurses and social workers and pharmacists and the rest of the team that they would be normally seeing as they go through their journey.
We know that we can give them information, we can give them literature, I can tell them chemotherapy side effects, but I haven't been through it. And, all of our information is useful up to a point. And, what we find is that, especially for the younger patients, but some of the older ones too, for younger patients, they don't know anyone who's been through breast cancer. They feel alone. They feel like they're the only ones to, experience this, these types of challenges.
To have a resource where you can reach out and kind of maybe find a person that can help you in that journey and not have to, leave it up to your friends or the universe to bring that person into your sphere is really, I think, gonna be transforming for a lot of patients in their journey.